Hello and welcome. Today we're diving deep into a critical, yet often overlooked, condition affecting the urinary system, bladder rupture. This occurs when the bladder wall breaks, leading to leakage of urine into the abdominal cavity. Understanding the causes, symptoms, and treatment of this condition is crucial for timely diagnosis and management, ultimately saving lives. So, what causes the bladder to rupture? The primary culprits are trauma, either blunt or penetrating. Car accidents, falls, and direct blows to the abdomen are common causes of blunt trauma. Penetrating injuries can result from gunshot wounds or stab wounds. However, bladder rupture can also occur spontaneously, particularly in individuals with pre-existing bladder conditions like tumors, infections, or bladder outlet obstruction. Iatrogenic causes, meaning those resulting from medical procedures such as transurethral resections or catheter insertions, also contribute to cases of bladder rupture, especially when the bladder is distended during the procedure. Now let's explore the pathophysiology. When the bladder ruptures, urine leaks into the surrounding peritoneal or extraperitoneal space. This leakage triggers an inflammatory response. Urine contains various waste products and electrolytes, which can irritate and damage the surrounding tissues. In intraperitoneal rupture, where urine enters the abdominal cavity, peritonitis and inflammation of the peritoneum, the lining of the abdominal cavity, can develop. This can lead to serious complications, including sepsis and even death, if left untreated. In extraperitoneal rupture, urine leaks into the tissues surrounding the bladder, causing localized inflammation and potential abscess formation. Regardless of the location, the leakage compromises the bladder's ability to store and eliminate urine, further exacerbating the condition. Regarding epidemiology, bladder rupture is relatively rare, but its occurrence is often linked to the prevalence of trauma in a particular population. Regions with high rates of traffic accidents or violence tend to see more cases. Men are more commonly affected than women, likely due to higher rates of trauma exposure. The incidence also varies based on age, with younger individuals being more prone to traumatic ruptures and older more likely to experience spontaneous ruptures secondary to underlying bladder pathologies. The signs and symptoms of bladder rupture can vary depending on the severity and location of the rupture. Common symptoms include abdominal pain, often described as diffuse and worsening. Patients may experience difficulty urinating or an inability to urinate at all. Blood in the urine, or hematuria, is another frequent finding. Depending on the location, patients may also have signs of peritonitis, such as a rigid abdomen or guarding, and symptoms of shock such as rapid heart rate or low blood pressure. In cases of pelvic fracture, there may also be physical signs such as pelvic instability or bruising. Diagnosing bladder rupture requires a high index of suspicion, especially in patients presenting with trauma or relevant risk factors. The gold standard for diagnosis is a cystogram. This involves injecting contrast dye into the bladder and taking X-ray images to visualize any leakage of the dye outside the bladder. CT cystography is another useful imaging modality. In some cases, a retrograde urethrogram may be performed to rule out urethral injury before performing a cystogram. Clinical assessment, including a thorough medical history and physical examination, is crucial in guiding the diagnostic process. Bladder ruptures are typically classified into two main types: intraperitoneal and extraperitoneal. Intraperitoneal ruptures occur when the bladder wall tears, allowing urine to leak directly into the peritoneal cavity. These ruptures often require surgical intervention due to the risk of peritonitis. Extraperitoneal ruptures involve tears in the bladder wall where urine leaks into the tissues surrounding the bladder, but not into the peritoneal cavity. These ruptures are often managed conservatively with catheter drainage, although surgery may be necessary in certain cases, such as when associated with open fractures. Treatment for bladder rupture depends on the type and severity of the injury. Intraperitoneal ruptures typically require surgical repair. This involves surgically closing the bladder wall and draining the peritoneal cavity. Extraperitoneal ruptures may be managed non-operatively with bladder catheter drainage. A catheter is inserted to decompress the bladder, allowing the tear to heal naturally. However, surgery may be required if there are associated injuries, such as open fractures, or if conservative management fails. Antibiotics are typically administered to prevent infection. Pain management is also an important aspect of treatment. Preventing bladder rupture primarily involves minimizing the risk of trauma. Safe driving practices, such as wearing seatbelts and avoiding distracted driving, can help prevent car accidents. Fall prevention strategies, especially for older adults, are also important. For iatrogenic ruptures, careful surgical technique and avoiding over-distension of the bladder during procedures can reduce the risk. Prompt treatment of underlying bladder conditions, such as bladder outlet obstruction or infections, can also help prevent spontaneous ruptures. The prognosis for bladder rupture is generally good with prompt diagnosis and appropriate treatment. The majority of patients recover fully with minimal long-term complications, however. Delayed diagnosis or inadequate treatment can lead to serious complications, such as sepsis, organ failure, and even death. Recent research has focused on improving diagnostic techniques, such as using advanced imaging modalities and developing less invasive surgical approaches. Furthermore, studies are ongoing to explore the use of regenerative medicine to promote bladder wall healing after rupture.